Today we're going to continue and conclude our series on subclinical gluten intolerance. We're going to start by talking about multiple delayed food allergies. Subclinical gluten intolerance often leads to the development of multiple delayed food allergies, which many of you watching this are suffering from. Leaky gut syndrome and the accompanying premature leaking of food antigens into the bloodstream causes it. In time, this overexposure to food antigens cause the immune system to react, and foods that would otherwise be tolerated can become allergenic. Although the problem with food allergies is generated by the damage from gluten, removal of gluten and pasteurized dairy from the diet is not always sufficient to remedy this problem. Depending on your circumstances, I may recommend a 4 to 5 day rotation diet or food allergy testing. And for many of you, you've already done food allergy testing. There are different types of food allergies. Some are immediate and some are delayed. Immediate food allergies are usually easy to recognize. For example, you eat a strawberry, you get a rash. These don't usually require testing to determine. However, delayed food allergies are hard to identify because the reaction may not appear for hours or even days after eating the offending food. For example, eating an allergic food on a Monday night could generate a migraine headache or cause fatigue on Tuesday or Wednesday. Due to this difficulty in identification of delayed food allergies, one of the two strategies should be used, one of two strategies should be used. The first is the rotation diet. By doing this, even though the exact foods to which you are allergic maybe haven't been identified, you'll be rotating all of your foods so that any delayed reaction response will be significantly reduced. This reduces the stress on your hormonal and immune system. The second option, which is one that I often pursue, is the multiple food testing, because there are great ways to test, and I send a test kit home with the patient. They take care of it, mail it into the laboratory, and then within just a matter of days we get the test results. This testing is done from a blood sample and identifies exactly which foods you're reacting to. You'll then know what foods to avoid and what foods are safe. Now, let's talk about allergy versus intolerance. There is a great deal of confusion and misinformation about food allergies and gluten. Gluten intolerance is not a typical food allergy. It is an inherited condition that leads to mucotoxic or inflammatory response. Gluten intolerance is a genetic base, or it has a genetic basis, meaning it passes from generation to generation. Gluten intolerance is found most frequently in those with Irish, English, Scottish, Scandinavian, and other Northern European or Eastern Europe heritage. The research study published in the British Medical Journal in November of 1988 found previously unheard of numbers of people suffering from celiac disease from the medical condition we mentioned in the very beginning of our series related to gluten intolerance. They found approximately 1 in 150 people with this condition. It is suspected the levels of subclinical gluten intolerance are really much higher, perhaps as high as 1 in 3 Americans. That's a big deal. Subclinical gluten intolerance and celiac occur less frequently in non-European populations. It's important to note that many people who are gluten intolerant don't test positive on food allergy testing for wheat, rye, barley, and other gluten-containing grains. So don't be misled by the fact that you don't test positive for gluten-containing foods. You still must avoid the offending gluten foods if you are gluten intolerant. Many people live for 30 or 40 years with subclinical gluten intolerance and don't experience obvious symptoms. Some people who are constitutionally strong and eat small amounts of gluten-containing foods may never experience the symptoms. However, with or without obvious symptoms, intestinal damage is still taking place. Now, along with gluten intolerance comes food cravings, and it's been frequently observed that people crave that which they're allergic to. So please take note, if you crave gluten or bread or wheat or gluten-containing foods, there is a high probability that you're gluten sensitive. I tell people, write down your 5 favorite foods, and those are probably the very foods that you have sensitivities to. And believe me, that's more often the truth than not. The structural changes to the small intestines from gluten intolerance create the perfect habitat for developing pathogenic infections. Inflammation in the small intestines cause a structure called crypts to deepen. The elongation of these crypts, referred to as crypt hyperplasia, and deepening of the crypts makes for a deep pocket where a pathogen such as a parasite can survive by evading the usual immune surveillance that occurs in the lining of the tissue. Inflammation also slowly destroys the immune cells that help protect this area, and these two factors taken together create a situation where parasitic infection can take hold and become chronic. Parasites deeply embedded into the intestinal lining can even be resistant to powerful antibiotic treatments. Because of this, people with gluten intolerance need to rule out the possibility that they are harboring a chronic parasitic infection. Eliminating glutens from their diet can be the first step in getting these chronic infections cleared. Now, there is a relationship between candida and opportunistic organisms in the gastrointestinal tract and food intolerances. Inflammation caused by subclinical gluten intolerance and or lactose intolerance weakens the immune response in the intestinal lining. This weakening, or this mucosal weakening, affects the immune defense and can open the door to candida to overpopulate and become invasive candida. And invasive simply means to invade and attach itself to the healthy mucosal lining in the intestines. Now, the intolerance in gluten causes multiple nutritional deficiencies, including inability to absorb fats, proteins, and carbohydrates. Malabsorption of fats leads to deficiency in the fat-soluble vitamins such as vitamin A and E and K, and importantly, the essential fatty acids from which we manufacture all of our reproductive hormones and adrenal hormones, including estrogen, testosterone, progesterone, cortisol, and DHEA. Other nutritional deficiencies that appear early in the disease process include lack of calcium, folic acid, iron, and vitamin B. Lack of reproductive hormones leads to disruption of the normal menstrual cycle, causing PMS or menopausal symptoms. The combination of calcium deficiencies and female hormone imbalance leads to osteoporosis or weakening of the bones. Even if women take estrogen and calcium supplements, they may not be adequately absorbed. Folic acid, B12, and iron deficiencies lead to anemia, depression, and increased risk of heart disease and neurological diseases. Lack of the antioxidant vitamins E and A compromise our ability to fight free radicals and can further contribute to degenerative conditions such as cancer and heart disease. I know that this has been an incredibly long series, but the information is absolutely vital for those suffering with subclinical gluten intolerance. I think you can see that there is no body system that is untouched by gluten sensitivity, and that if you have gluten sensitivity, there's literally no way to restore your health without eliminating it from your diet and repairing the damage that it's caused. Thank you so much for sticking with me. I appreciate that. I hope and pray that the information has been useful. Thank you, and God bless.